You just had a breast ultrasound or mammogram, and the report says BI-RADS 3, or maybe it says BI-RADS 4A. Now your mind is racing. Does this mean cancer? Do I need surgery? Should I panic? The short answer is no, you should not panic. But you also shouldn't ignore it. BI-RADS stands for Breast Imaging Reporting and Data System. It is not a final diagnosis. It is a standardized language used by radiologists to describe what they see and guide your exact next steps. The scale goes from 1, negative, to 6, proven cancer. When you see a 3 or a 4A, remember this: the number is a risk category, not a diagnosis. Let's start with BI-RADS 3. This means probably benign. In plain English, the radiologist is saying, this looks very likely to be non-cancerous, but we want to watch it carefully. The key number for BI-RADS 3 is less than 2%. That is the expected chance of this spot being malignant. Because the risk is so incredibly low, doctors usually do not recommend an immediate biopsy. Plunging a needle into every BI-RADS 3 nodule would cause unnecessary stress, cost, and potential complications for something that is almost always harmless. Instead, the plan is short-term follow-up imaging, usually in 6 months. The goal is to prove the spot remains stable. If it doesn't grow or change shape, that is highly reassuring. If it does change, your doctor can safely upgrade the category and act then. Now, let's talk about BI-RADS 4A. Category 4 means the finding is suspicious enough that a biopsy should be considered. But Category 4 is divided into A, B, and C. BI-RADS 4A is the lowest level of suspicion within this category.
The estimated chance of malignancy is between 2% and 10%.
You might wonder, if the risk is still that low, why do I need a biopsy? Because a 4A is no longer clearly probably benign. The radiologist sees a feature they simply cannot confidently identify through imaging alone. A biopsy, taking a tiny tissue sample for pathology, answers the ultimate question: what exactly is this? Most 4A biopsies come back entirely benign. The biopsy is simply a diagnostic tool to make absolutely sure.
Here is the easiest way to compare your next steps.
Meaning probably benign and low suspicion. Cancer risk less than 2%, between 2% and 10%. Usual next step, follow-up imaging, e.g. 6 months. Tissue biopsy. Medical goal monitor for stability. Confirm exact tissue type. Do not compare your report to someone else's online. 2 people can both have a painless lump, but based on shape, margins, and density, one might be a 3 and the other a 4A. Your goal right now is not to panic. It is to complete the right next step. Here are the questions to ask your doctor. For BI-RADS 3, when exactly should I repeat my scan? And what changes should make me come back earlier? For BI-RADS 4A, what specific feature made this suspicious? And what type of guided biopsy will I be having? Even with a reassuring BI-RADS score, clinical context matters. You must seek immediate evaluation if you notice physical red flags, including a lump that is noticeably growing, new bloody nipple discharge, skin dimpling, thickening, or redness, a new lump in your armpit. Let's quickly summarize the common mistakes you need to avoid. Do not think BI-RADS 3 means no follow-up needed. Do not think BI-RADS 4A means I definitely have cancer. Do not skip a recommended biopsy just because you feel fine physically. BI-RADS 3 is about watching for stability. BI-RADS 4A is about getting tissue confirmation. Neither means you should lose sleep, but both require you to show up for your next appointment. Understand the category. Ask the right questions. Take a deep breath and complete your next step. Logo, outro, scene.